Welcome back to Gentle Dental. I am Dr. Sarah Chinnery, and today I am so excited to introduce to you someone very special to me and someone that works so much behind the scenes in a dental office. It's a position that if I didn't have, the office would not function without a dental assistant. So today you're going to hear Ruth's story. I had the opportunity to work with Ruth at a private office in Iowa. She currently has 18 years of experience and is working with an oral surgeon in Ohio. She is so talented as a dental assistant, not only with patient care, but also her day-to-day job and managing, functioning, and wearing all the hats behind the scenes. So today you are going to hear her journey, what's it really like to be a dental assistant, and tips for anyone that's curious about the job. So Ruth, can you share a little bit about your story? And how did you decide to become a dental assistant?
Sure. So my name's Ruth. I have 18 years of experience with dental assisting. Basically, I just really always loved going to the dentist as a kid. I spent a lot of time in the dental chair, sadly, to admit that. But I feel like my assistant and the hygienist always made me feel so comfortable being nervous as a child, being at the dentist. And so I wanted to be involved in healthcare in some aspect. And so honestly, one day I was watching TV and there was a commercial on about a local school for dental assisting. And I was like, you know what? I think I'd be really great at that. So I called the school and luckily they were enrolling and I started not long after that. Here I am, 18 years later, still loving my job and helping to provide good care for patients, make them feel comfortable.
Did you go to school or did you learn on the job?
Yeah, so my school was a 10-month program, full time. Went every day, Monday through Friday from 8 to 1. Lots of hands on experience, different courses, anatomy, radiology, chairside assisting, coronal polishing, all of the good stuff. We had a pretty big class. I'd say for dental assisting, there was at least 10 of us in the school and we practiced on each other. So 10 months, we had a graduation and then we went and did like a 3-month externship before we were able to actually work in the field.
That's awesome. Where did you start your career at?
I lived in Colorado at the time. I went to a dental assisting school there in Colorado and started at an office not long and have just worked my way up over the years.
How would you describe what a dental assistant is?
I would say that the dental assistant is the doctor's right hand person or left hand, depending which hand they use for dental assisting. But basically, we help to keep the day running smoothly. We help to make sure the patients feel comfortable and are educated about the procedures that they're about to have done or the treatment that they need to have completed. The dental assistant wears many hats. We do a lot of different things, but first and foremost, main priority is to make sure that the patient is comfortable and taken care of and understands why and what we're doing for them.
Are there different roles within the dental assisting, like a lead or someone in charge of labs, anything like that?
Like I said, dental assisting has a lot of different hats. Most dental assistants all do the same things. There are other certificates that allow certain dental assistants to do more things. For instance, an EFDA or an expanded functions dental assistant can actually place the filling for the dentist. That does require a little bit of extra training, extra schooling. But for the most part, registered dental assistant can take your x-rays or they can take impressions. They could do a lot of things, honestly. Usually in a bigger practice, a doctor will have more of a lead assistant. That person takes on the duties of making sure that we have all the materials needed to care for the patient, make sure that all the other dental assistants are trained and taking care of patients properly. Sometimes a lead assistant will even help the front with insurance verification, treatment planning, treatment coordinating, things like that, presenting treatment to patients. We do a lot of different things from sterilizing instruments to caring for the patient to presenting a treatment plan to educating patients on what they're having done and why they're having it done and how to prevent having to come back to have the same type of treatment done in the future.
You wear a lot of different hats.
Definitely. We are busy.
Was there a moment when you knew this was the right career for you?
Not necessarily the first time that I helped a patient through treatment, but someone that was very scared of being at the dentist and was very embarrassed of their smile, revealing their new smile to them and seeing the emotion and just the glow that they had. There's something so fulfilling about that. And that is the reason that I love my job, to help people smile again and to like change the stigma about dental offices and let you know that we're actually there to take care of you and we want you to feel comfortable and we want you to feel confident in the treatment that we're providing for you.
Is there anything that you wish you would have known before you began dental assisting?
I actually didn't realize when I first became a dental assistant the growth opportunities that it would provide for myself. Not only am I a dental assistant, now I'm phlebotomy certified. I can place IVs, I can monitor patients under sedation. So it's really helped me grow as a person and also in my career. I just thought, oh, well, I'm just a dental assistant. That's actually not the case at all. We're actually a pretty important role, I would say. Maybe I'm tooting my own horn. I don't know. But I feel like patients really look forward to their dental assistant, especially someone that can be empathetic and compassionate and just make them feel at ease. And so I didn't realize really the opportunities that I would have to care for people in dental assisting.
And I feel like a lot of times if patients are like not sure if the doctor what they're saying or things like that, they look to you guys to be like, is this real? Should I do this? Like, what's going on?
Absolutely. I feel like sometimes doctors have a habit of saying it in like a doctory way. So we're kind of there to put it more in layman's terms, I guess, and help patients understand better what the doctor had already explained. So it just really helps put them at ease when they can hear it from a person who's actually been in the dental chair themselves and just can like explain the procedure a little more less stressfully, I guess.
And it's an actual benefit and not just like us saying something.
Right, that you're not just there to, like, make money or something like that, like, you actually do need this treatment. I feel too like the more education you have as a dental assistant, you're able to, like, point these things out on an X-ray. We don't diagnose, we wait for you guys to come in and tell the patient what they need, but then when you leave the room, we have the opportunity to maybe review the X-ray or point out certain things that help them take ownership in things that, they have going on and why they need to have it done, what would happen if they didn't move forward with the treatment and things like that.
So I didn't know that you were certified as a phlebotomist. Tell me that journey and why you're doing it.
Throughout my career, I've mostly worked in a general practice, which provided me to be able to do a lot of different procedures from fillings to crowns, bridges, partials, dentures, implants, extractions. But with about the last year, I really have gotten into surgery and IV sedation is a big role at the office that I'm working at. We also do PRGF, which is basically where we take a patient's blood and separate it and use their plasma serum to create biological membranes and help their bone graft take better because it has their own growth factors in it. So in order to do that, I had to go to a phlebotomy course to be able to properly take blood from a patient. And then with that, I was able to move on and get IV certified so that I can place IVs for the doctors so that we can do larger treatment plans and keep the patient comfortable and they go to sleep and they wake up with a new smile and it's pretty cool.
That's awesome. Do you work with an anesthesiologist at all?
He's an oral surgeon. We place the IV for him. He pushes all the meds and pretty awesome actually. I
That's
love
really
it.
cool. Would you recommend people shadowing dental office before they either start on the job or go to school?
I think it's a good idea to shadow an office just because a dental assistant does wear so many hats. Having an idea of all the things that are going to be on your plate as a dental assistant and making sure that it's a right fit for you, I do recommend shadowing an office for sure.
For those that don't know, can you kind of explain the differences between like from no training to dental assisting school to an EFTA?
Someone with no training, usually they start in the office and we have to start with the basics of teaching teeth numbers and all the things. Makes learning a little harder, but there are a lot of people who are go-getters and are determined that they want to learn it and can be very successful in that realm. It really depends on the state that you live in, if you can be on the job trained or if you need to have some credentialing through a dental assisting school. So like I said, every state's a little bit different. Dental assistant who's went through a program typically has learned all the basics of dentistry, what the materials are, the different procedures, how to take radiographs, how to take panos, impressions, things like that. Someone who is an EFTA has already become a registered dental assistant. Typically, the state requires that you become a dental assistant before they let you go on to EFTA school. EFTA school, you're learning more how to place a filling, how to basically help keep the schedule flowing so that the doctor could be in multiple places at once. EFTA does, where I live in Ohio, I believe it's a 9-month program and they go once a week and they just jump right in. It's literally an all-day course. They're placing fillings on dexters or tapedots and then their doctor would allow them to eventually place fillings in the office for them.
Are EFTAs in every state?
I'm assuming yes, because it is a permanent restoration. I don't know Every state's a little bit different. I know Ohio's very strict. You definitely have to go through the Ohio program. I have an EFTA from Colorado that they don't recognize because each state has a little bit different criteria. So, depending on the state that you live in, you would need to follow up with the dental board just to kind of see what you can and can't do. Obviously, an office is going to let you know too what the requirements are to be able to come in and be an EFTA in their practice. Most of those licenses have to be updated every year or every 2 years, meaning we're all required, whether we're dental assistants or EFTAs, we're all required to take a certain amount of continuing education each year to prove that we're staying up to date on all the latest and greatest procedures and technology for dental assisting.
I believe it depends on the state, actually. Some of the states don't allow EFTAs, and then I think some of them also, depending on the state, allow certain EFTAs to do certain things. In Missouri, they can do operative, so fillings. It's two different classes, but if you get those both classes, you can do fillings on all of the teeth and then in all the surfaces. There's ortho EFTA certificate, so they're able to place buttons, and there's PROS. They're able to work on crown and bridge, dentures, partials, things like that. So it just depends on the state. Do you have a license, and how do you keep up with it?
So I believe that most states, the way that they do it, if you were to get hired with no training, you would work with that doctor or you would need a certain amount of hours before you would be able to take the exam to become registered. So I think in the state of Ohio, it's 3,500 on the job hours. The dentist would then sign off on a paper, which would allow you to go take the dental board test, basically, to become registered in that state. But like I said, each state is different. I believe like Colorado, you didn't even have to have a license to be a dental assistant there. But then when I practiced in Iowa, we did. We had to have X amount of CE hours every year, and we had to update our licenses every 2 years. There are such thing as like a training license. Like for instance, I had a lot of experience when I moved to Iowa to become a dental assistant, but I still had to be under a training license with Dr. Burhoop, and he had to sign off on my hours before I could go take the actual test to get my licensure in Iowa. We did PRF in Illinois. We do PRGF here, so a little bit different. We take factor 1 and factor 2 of the plasma, make a membrane in one dish, and then mix the other with the bone, and then it comes like a sticky bone, basically, that we place in the socket. So I've learned a lot over the years. I feel like I'm continuously learning, even though just when I think I know like most things in dental, there's a wrench thrown in and I learned something new. So it's fun.
That is really cool. Can you describe your favorite role or task as a dental assistant?
I just love making the patient feel comfortable, trying to lighten the mood in the moment, especially working in a surgery office now. They're either in pain when they come in the practice or they're just scared to death. So just being able to walk them through the procedure and let them know that they're in good hands, trying to keep them comfortable in any way possible, whatever helps them to be more comfortable in the chair and how I can accommodate that. That's really my favorite thing besides helping people smile again.
Do you think it's helpful if someone tells you that they're nervous or don't want to be there, or can you just kind of figure it out from the vibes?
At this point, I just expect that they're nervous. I always greet a patient and I'm like, hi, my name's Ruth. I'll be taking care of you today. How are you? And the first thing out of their mouth is, I'm scared. I try to lighten the mood and be like, well, if you told me you were excited, I'd be concerned. So a lot of people feel the way you feel, but we found that we're able to keep you comfortable. And if they're going to sleep for their procedure, I always just encourage them that they're probably not even going to remember being there. They're going to wake up and think they missed their dental appointment and it's already going to be over. So don't be scared.
Awesome. How do you work alongside the dentist and other team members?
Basically, working alongside the dentist just means that we try to be one step ahead of him. His main focus is the patient, and obviously, his field of view is pretty small. It's just about right here. So, we're his hands and eyes to keep things clean and dry in the mouth, to have the next instrument available so that he's not constantly having to look away from what he's doing. With other team members, just being a team player, trying to help wherever we can, just to keep the flow of the office running smoothly, to be respectful of patients' time. If they have an appointment, they want to be seen in a certain amount of time and they want to be able to get out of there on time. Maybe they have other things that they have to keep going. So teamwork is huge in dental. You're not just providing for a patient, but you're keeping the flow of the office running smoothly.
And I feel like assistants are really vital for like the scheduling aspect too, to keep things flowing or changing things if things aren't matching up on like depending on how many columns someone has.
Yeah, we definitely play a vital role in keeping the doctor on time. It's easy for a doctor to get in and get chatty with another patient. And sometimes you got to go kindly remind them, like, "Hey, we have this going on over here." Doctors don't want to be in a rush with the patient or make the patient feel like they rushed through a procedure. So the dental assistant is able to help to smooth over that overlap of time where a dentist may have to be in with someone else. We're able to be in there walking them through the procedure or talking them through any questions that they may have while we're waiting so that the patient doesn't just feel like they're trapped in a room without anyone. So, keeping the schedule flowing and on time is key. It doesn't always work out. There are emergency situations that happen that make a doctor run over a little bit. And just being able to communicate that with the patient in a kind way is very helpful.
Makes a great dental assistant, and why is that role so valuable to a practice?
I think what makes a great dental assistant is someone that has an upbeat personality, someone that is cheerful because patients are typically nervous or scared to be at the dentist in general. It took them a lot to make the phone call and make it to their appointment. So someone who's greeting them with a smile and an upbeat attitude is key, I think. And I think that's anywhere you go in life anymore. The more friendly people are, the better attitude that they have, the more you want to be there and the more you want to tell your friends all about it. Dental assistants are vital because we communicate not only with the dentist, but the front staff. We let them know what's going on so that they can communicate with patients. We're basically a liaison throughout the whole office. Like I said, we're not just there to take care of patients, we're cleaning rooms and sterilizing instruments and making sure that things are ready to go for the next patient long before they're even there. So there's a lot of behind the scenes stuff going on to just make sure that we're providing excellent care.
And you guys are also helpful with ordering materials and creating treatment plans and going through that with patients too.
Yeah. So typically on a first visit with a patient that's new to the practice, we're going to seat the patient, talk to them about their concerns or things that they may want to do with their smile. Maybe they want a wider smile. Maybe they want a straighter smile. Maybe they're in pain. So gathering all the records, taking the x-rays, putting together everything so that when the dentist comes in, he has all the information needed and he can look in the mouth and compare things to the x-rays, provide a treatment plan. Then our next step would be to enter all of that treatment that the doctor discussed with the patient into the system so we could let them know what their insurance benefits are going to cover, what their out of pocket might be. Sometimes that can be a little overwhelming for a patient. So I like to go a step above and beyond and make it not so overwhelming and kind of help the patient break it down by order of importance or maybe break it down by quadrant just so that it's not so overwhelming to see because dental is not cheap and insurance is not, it's more of a coupon than a benefit. It's completely different from medical. So just I think sometimes patients see the price tag and then they get overwhelmed and they don't come back. So if you can help them break that down in a way that meets their budget, I feel like that's a vital role, not only for the office, but for the patient as well. It helps them see that it is achievable rather than just being like, oh my gosh, I can't do this. How am I ever going to do this? But getting a patient out of pain first and then helping them to clear the disease from their mouth or whatever their situation is and making it fit their timeline and their budget and making sure that they are educated to get the procedures and stuff done.
What's something patients might not know that you do behind the scenes that's essential for their care?
Well, we make sure that all the materials that are needed to provide treatment are up to date and current and obviously not expired. We maintain the equipment. We make sure that the sterilizers have their weekly and monthly maintenance to make sure that the instruments are clean and packaged properly so that they're sterile for the next person. Gosh, we do so many things. We clean the operatories. We set up and make sure that everything's ready so that when the dentist comes in the room, we're able just to sit down and get to work and help them get out of the chair that they don't want to be in and get on with their day. We stay up to date on our certifications. So even sometimes when we're not at work, we're at continuing educations or we're learning how to be better for them.
It's also helpful whenever like an assistant will come back and talk to the doctor about the patient summary so that we're not walking in blind.
Yeah, it's funny because I feel like a lot of times we probably are asking the same questions. I know I try to gather all the information that I can. And then when I go let the doctor know the patient's ready, I give that whole spiel of everything that I just gathered from the patient. But then the doctor walks in and asks all the things again. So we're all on the same page too. I think a lot of times patients hearing things from you and then from us and then from a treatment coordinator just helps keep reminding them of, how we are going to help them get their mouth healthy again. Yeah, so don't think that we didn't tell the doctor all the things you told us. They just need to hear it for themselves as well. You don't want to just give the information to us and then the dentist just come in and go to work. We do preheat the doctor and let them know everything that's going on, but they probably will come in and still ask a lot of the same questions that you've already told us. So we just want to make sure that we're getting it right and that, we're providing the best care for you.
And sometimes you'll forget to mention something, so then when you get asked the second time, it might be a different answer.
A lot of times it's a different answer, or that they might be like, no, that actually isn't really an issue. And then the doctor comes in and we're like, wait, we asked that too. How come you tell us that part? That was vital. That was important. So it's kind of funny. But people are nervous. And so maybe the doctor asks it in a different way. And then they're like, yeah, that actually is affecting my life.
What is your favorite thing about dental assisting?
I love assisting, honestly. I don't know. I'm kind of a nerd. I just love learning new things and I try to put myself in their position. Like it's scary to be in the dental chair. I am not a good dental patient. So it's funny that I provide such good care, but I think I put myself in their shoes and I'm like, okay, well, if I was here, this is how I would feel. And these are the things that I could do to make them feel more comfortable. So I don't know. I just love my job.
You're very good at it.
Thank you.
What is your favorite procedure to assist with and why?
Most recently, it's probably all on six, all on X cases where a patient maybe hasn't been to the dentist for most of their life. We're able to gather all the records and provide them to go home with a smile the same day. The big reveal to me is like my favorite part. It's a very long procedure. It's very hard on the patient. The recovery time is hard, to be honest, but to watch them look at their smile at the end of that procedure, there's nothing better than that.
For those that don't know what like an all on X or an all on 4 or 6 is, can you just kind of explain that a little bit?
For someone maybe that hasn't taken good care of their teeth or hasn't been in a position to be able to see a dentist, they probably have a lot of decay going on. Maybe they're missing teeth because they couldn't afford to get them fixed at a certain time in their life. So now they have spaces or they have periodontal disease. We would extract all or some of the teeth, place implants, and make you a set of teeth the same day that would screw into the jaw. A lot of people don't want to wear a denture or have something that they have to take in and out and care for and risk falling out when they're talking, or just all people's fear of wearing a denture. So the fixed cases are screwed down and they're permanent. They only come out when you go in to see your dentist or your hygienist, once or twice a year for a cleaning. Do still have to see us even after those procedures. Bacteria can sit around the implants. We want to make sure that the bone is staying healthy and that you're keeping things clean. And there's areas that your toothbrush can't get. So we need to take those off, make sure your implants are still nice and solid. So basically, we take you from a not so happy smile to a beautiful smile in one day.
That's awesome. Are there certain procedures where your role is especially important for the patient's comfort?
So, since I've been in my surgery office and actually at a general practice that I worked at as well, we did oral sedation or IV sedation. So, my role in that is a little bit different because we're monitoring your pulse, we're monitoring your oxygen saturation. We're making sure that you're breathing and that you're not choking and that your airway's open. And so, those things are obviously vital when a patient is wanting to be put to sleep for a procedure. Yeah, so that's pretty key. It's pretty important to keep the patient alive.
Yes. How do you prepare for different types of appointments, whether it's like a filling or crown, extractions, implants, all that stuff?
So most offices, we try to sterilize and bag our instruments by procedures. So maybe we have a composite setup, or we have a crown and bridge setup, or we have implant setups. Basically, we look ahead at the day, we make the trays, we set up the room, get all the materials out that would probably be needed, most likely be needed, and maybe a few things off to the side that you may or may not need during the procedure. Just trying to be fully prepared and looking ahead so that you're not rushing through a procedure. We try to make it easy in that way by having things broken down by different types of procedures.
Are there any challenges working with different dentists?
Challenges working with dentists. Not everybody's right handed. And honestly, when you go to dental assisting school, you learn how to assist from the left side. So when you start working for a left handed dentist, you got to learn how to do those things from the right side. Taking care of your own ergonomics and postures and things like that is challenging because different dentists are different heights. Some stand, some sit, some are left handed, some are right handed. Just learning how to be able to still do your job, but take care of yourself in those things can be a little bit of a challenge sometimes. Different doctors have different personalities. So, what one doctor may want you to do with their patient, another won't. So, learning and understanding their personalities are huge, or what their expectations are of you as a dental assistant, and learning to never really take anything personal. Because in that moment, the dentist is in there to take care of his patient and may grab something out of your hand in a way that you would take personal. But honestly, it's just to get through the procedure and get the patient out of the chair that they don't want to be in. So, not taking things too personal.
I mean, if you work in a practice that has different doctors, sometimes you're working with 2 to 3 different ways of doing things, and you have to remember which doctor wants this handed next and
Yes.
whatever, so it gets kinda crazy.
It does. And different doctors use different materials. Maybe one doctor doesn't use something that another doctor uses. The first practice that I worked in was a 4 doctor practice. 2 of them were left handed, 2 of them were right handed. So, depending on the day, we had to switch the room around. We had to put his chair on the other side, put our chair on the other side, be able to change in a moment, basically. If we were working with right and left handed, that made it exceptionally hard because sometimes there was overflow and we had to share operatories. So, you're flipping things around in the moment in a rush, and the patient would never know, but we're back there sweating trying to make it all go down. It's interesting. I've worked with dentists who have been in the field for 30 years, and I've worked with newer dentists, and it seems that older dentists, they do things more of an old school way, maybe less materials. They could put a filling in with any instrument. A newer doctor may require more instruments and more materials, but you're still getting the same end result, which is what's important. So, just going with the flow. And like I said, never taking things too personal.
And you guys are responsible for, like, making sure things don't fall in the back of their throats or they're not
Yes.
swallowing anything, or is that we can see what's going on if we're having an extraction or whatever, that visibility sometimes can be difficult.
Definitely. Definitely protecting a patient's airway. You don't want something to fall down the back of their throat. They'll choke or aspirate, something like that. So we keep the area clean. We keep the doctor's mirror clean the whole time so that they can not have to come in and out of the mouth. We play a vital role in the field for sure,
Usually, like, upside down, right?
like this.
What is your favorite assistant hack that you've learned that makes procedures smoother for the dentist and the patient and the office in general?
Feel like me personally, my hack is just because I have a little bit more experience, I typically know probably what we're going to be doing next. So I try to enter all the treatment into the computer, having consent forms ready to be signed so that when they come in, the front desk is already working on a treatment plan. The doctor leaves. The next step is they come in, go over all the consent forms with you, and helps us to get started maybe more quickly. Just like I said before, trying to be a couple steps ahead of the doctor just to help the patient's procedure go more smoothly or appointment go smoothly.
And yeah, it saves a lot of time when you do things like that. What advice would you give someone who's considering becoming a dental assistant?
I'd say go for it. It's great. It's fun. It's a lot of fun. If you're an empathetic and compassionate person and want to help someone feel more comfortable in a scary situation, I say do it. It's very rewarding. There's a lot of growth opportunities dental assisting, so you're actually not just, sucking spit basically. You're a lot more than that, and it's very rewarding for you as well. So, the dentist, they couldn't do their job without you. So you're a very important part of the procedure. So I would say go for
Very,
it.
very, very
I
important.
act I actually teach part-time at a dental assisting school to hybrid students. So on Tuesdays and Thursday nights, I go into school and we do labs. And so it's been a lot of fun to like help train the next generation of dental assistants and get them pumped about what the job is more than just sucking spit, like I said.
A good thing to know that if you don't want to work in a general dental office, maybe you can go towards a specialty, whether it's ortho, endo, oral surgeon, like, it doesn't have to be general dentistry.
No, definitely. If there's a procedure that you love, maybe you wanna get more into a specialty. I think it's fun to work at a general office because there's a lot of different procedures happening throughout the day. When you're in a specialist office, you're doing the same thing all day, every day. So, yeah, explore those maybe by starting at a general office and kind of figuring out where and what you're good at, and then, you can grow, do a lot of different things with your career.
For patients, is there anything that they can do before or during an appointment to make things less stressful, like headphones, blankets, things like that?
Yeah, at our office, we provide headphones or noise canceling headphones. A patient can bring headphones with them, listen to an audiobook or some music while we work on you. Most offices that I've worked at do have blankets. The dental office always feels really cold to a patient, even though the staff is usually sweating and running around like crazy. So we definitely provide blankets, neck pillows. I worked at a practice one time that offered paraffin wax for your hands so you could like get your hands moisturized while you were there. So there's a lot of different things. Don't be afraid to ask or bring a book. So if you do end up having to wait in a situation, you have something to keep you occupied rather than sitting there watching the clock. We really are trying our best to be respectful of your time, but sometimes things come up. So don't be afraid to ask. We usually have water, coffee, maybe even a snack if you need it. We're there to not just provide good dental care, but also keep you comfortable, keep you warm, take the fear out of the procedure.
Do you have a story or moment that you felt like it was, like, the most rewarding for you in your career so far?
I just really love when patients remember my name or they make a nice comment about me when they leave a review about the practice or office. Knowing that I made an impact on them, and that's probably the most rewarding. Can't pinpoint just one. There's been several circumstances where I felt like I did the right thing and I maybe even gave the patient a turning point in their view of the dentist or helping someone get through something that otherwise maybe they hadn't been able to do in the past. I just like to leave a good mark on people. Try to have a positive attitude all the time, even when I'm stressed and at work, because it can be stressful, especially when you wear so many hats and you're expected to do so many things. So when a patient recognizes that you were a vital role in their appointment, that's the best feeling. I love that.
I would encourage anyone that is being seen by the dentist to give their assistant a lot of grace and love because you guys do wear a lot of hats and you guys are usually running around with your heads chopped off and trying to do the best and try and keep the doctor on time and all the
Mhm.
things. It's a lot to manage.
Yeah. Yeah, I don't think patients realize that. They probably honestly wonder why the doctor's not in there with them more. But we're kind of like I said in the beginning, we're kind of the liaison. We're there to make the procedure not only run smoothly for the patient, but for the doctor. So, yeah, give us grace. Also, give us a shout out every now and then. We like that too.
Yes, if you've had a good experience, let them know because they need the praise instead of hearing about how much they hate being there.
Yeah, definitely.
Do you have anything else you want to share?
Don't be afraid to come to the dentist. We're going to take good care of you. Dentistry's come a long way, I think, and there's a lot of compassionate, really, really superb dental assistants and doctors out there, and give us the opportunity to make your experience great.
Ruth, thank you so much for joining me today and sharing your journey to becoming an expanded function dental assistant who's such a valuable member of the team. I love that you've shown how dedication, training, and the right attitude can turn this career into something truly rewarding. For everyone watching, I hope that you've learned a little bit more about what dental assistants do, why they're so essential in patient care, and maybe even picked up a few tips from Ruth's experience. If you've enjoyed this conversation, hit that like button, share your favorite takeaway in the comments, and don't forget to subscribe that you don't miss more interviews with amazing dental professionals. And if you have any questions for Ruth or about dental assisting in general, drop the questions below. We'd love to hear from you. Thanks for watching.